Currently in the UK, the most recent statistics show that 1 in 7 people are experiencing food insecurity. So that means that they don't have enough food to meet their household needs. And we know also that food insecurity has some significant health impacts, not only physical health, but also mental health impacts. So, for example, people who are living in food insecurity are more likely to be experiencing obesity, diabetes, high blood pressure, and also mental health impacts such as anxiety, depression, high stress, and also loneliness. So when people don't have enough food to feed themselves and their families, often they might go to a food bank. And we know that while food banks can be a good solution for people to access food in the short term and meet their short-term food needs in a time of crisis, we know that people often aren't able to access foods that meet their dietary requirements, meet their nutritional needs. And it's also quite a stigmatising experience. So research shows that people do experience quite a high level of stigma when they attend a food bank. And this means that people just don't want to go there and they're reluctant to access these services, and it just drives more hunger. So we know that alternative solutions to food banks are required. And that's where we think that social projects and social enterprise responses might play a role. So at the University of Liverpool, we wanted to explore social enterprises as an alternative to food banks in solving the food needs of people who are living in food insecurity. So we wanted to interview people who were accessing 2 food support projects which were run by Cancorp, a local social enterprise, and we also collaborated with Riverside Housing and the people who were participants in our research were social housing residents in Riverside Housing.
Robin Adelson, Director of Cancorp here in Shotton in North Wales. We're a food charity stroke social business, and we set up back in 2007, and so it takes us to run. We're about 18 years old, 18 and a half years older. We created the meal boxes because as an organisation, we've always been incredibly passionate about people being able to eat food that they would choose for themselves if they could afford it. And everybody was familiar with HelloFresh, and I was thinking at the time, so why can't we just give HelloFresh type boxes to everybody, make them cheaper, make them better, and make sure that people were getting the kind of choice that they would want to if they could afford to pay for it every single day. So we created the meal box approach out of that. Interestingly, the slow cooker came from a different place, because we taught about 19,000 people to cook, and it was clear that people wanted to cook something that was really cheap, really tasty, and really easy to cook and use. And so all those cookery lessons taught us that if we gave people a really cheap and effective tool, easy to follow recipes, and then measured ingredients, and that every single time the food turned out to be restaurant quality, they would be made up, and so it proved. I've been working in this vein of work for the last, like I said, 18 and a half years. And from day one, what I've known to be the truth is that people want to eat good food when they're hungry, and that nothing else matters. And so we've worked from day one to make sure that people get the kind of quality and choice that they would choose themselves if they had the money to do so. And that's been the really important factor. If you design a project, or as what we've done, a business, a food business, based on how the person eating the food would want the food to be, that's where you end up. If you design another service, and I'm not being critical of other services that are out there, but lots of other services are just about getting any food to people when they're struggling. That's not what this has been about. It's about choice, it's about quality, and it's about the quality of life.
So I think one of the reasons that we need social programs like ours to tackle food insecurity is really around what food insecurity actually means, and about the lack of choice, lack of access to good food. And we really bring good food to people where they need it. We bring it directly into their homes, and we try and make it as convenient as possible, because we've seen the price of food rocketing in the last few years, and we want to make it as accessible and as convenient as possible. So the Mealbox service is very similar to your classic recipe kit and delivery service. So each family or individual gets 5 recipe bags per week, and each recipe bag contains all the fresh ingredients that they need to create a meal from scratch for them and their family. So that includes the meat, the vegetables, the spices, as well as a recipe card, so they know exactly what they're doing when they get the bag itself. And alongside this, they also receive staple items, so bread, milk, eggs, butter and cheese. And they can receive this for up to 12 weeks. So every single week they choose from a menu, so that they know that what they're getting is what they would actually choose to eat for them and their family. And for this, it is free for 4 weeks, and then it is subsidised for the remainder of the 12 weeks. So for a 4-person household, it would be £10 for weeks 5 to 8, and £15 per week for weeks 9 to 12. Similarly, the cookery training project brings cookery training to families. So if the issue is that they're not sure what to do with fresh ingredients, they haven't had access before, we really teach them how to use those basic skills, how to chop an onion, how to chop a pepper, how to prepare fresh meat safely. And we run through loads of different skills like cooking on a budget, how they can go from using our recipe kits to creating a meal from scratch for themselves outside of those bags.
For the people that we interviewed, we found that their food insecurity was a major driver towards their mental and physical ill health. But when people were accessing the projects from Penco, they were able to access a consistent supply of fresh and healthy foods in an affordable way, and a way that wasn't stigmatising for them. And they really saw some health benefits because of this, not only physical health benefits, but also mental health benefits. People also felt like they'd improved in their confidence in the kitchen, and they learned more food skills. And they also showed signs of becoming more food secure. So really massive benefits for people who are accessing these projects. But most importantly, what we found was that as soon as the project ended and people didn't have this access to this fresh, affordable food anymore, they just defaulted with their food insecurity. So they were back into the same routines of implementing coping strategies to try and feed their families, and back to quite unhealthy diets and diets of processed foods. So it really shows the potential that these kind of social projects can have, but then also how vulnerable people are when they're accessing these social projects, because as soon as the project ends, they have no choice but to default back into these less healthy foods and food habits.
Good food actually does matter. And when good food is presented to people and they can afford it, they will always choose to go to it in the first place. So the big deal is, let's get the bad food out the system. And then let's make sure that affordability is the number one priority when good food becomes available. And what Natalie's research has done is proven that that is the case.
So this particular research has been really important to Riverside, because it's really shown and gathered really good evidence to support us in ensuring that we can extend this offer to our customers. The evidence shows that this type of project works to encourage more resilience for our customers and to create better, safer communities too. Customers who choose healthier options, there's lots of kinds of really positive outcomes that are associated with that. So for example, our customers therefore will be able to sustain their tenancies much better. They're less likely to get into rent arrears or face evictions because they can afford food and live better and have better diets. We found, because of this research, that our customers are better connected at the local community. There is less social isolation, because let's face it, coming together to eat is a social activity, and it really benefits, families and customers much more so than obviously not having that access to good food before. So that's really good, because that therefore reduce the social isolation in our communities, which is a real benefit for our customers and it's important to us at Riverside. The other aspect to that is it kind of creates safer communities as well. So it's well known that our customers, if they are happy and healthy, if they are eating well, they will feel physically better, they will feel mentally better, and they're more likely to engage in positive opportunities in their local community and therefore become more connected in their local community. So in terms of the future at Riverside for these kind of projects, I think it's given us some very clear evidence that this resilience offer for our customers in relation to food support works. So this will give us a really good opportunity so that rethink how we support our customers in Riverside and replicate this sort of project throughout all our communities across Riverside, supporting more customers and also ensuring that we link up with those external kinds of organisations and those key partnerships that we've got and stakeholders in our communities, and really promote this kind of research and the evidence of all that good food provided to our customers in need really does make a difference and can create safer and more resilient communities, social housing customers.